firm where justice finds its voice.
From the Newschannel 5 network, this is Morning Line with Nick Beres.
Good morning, everyone. Thanks for joining us on Morning Line. And Nick Beres here with you, 8 o'clock on a Thursday. A really good show. As always, you're going to be invited to join in the conversation because this is live today. The number is 737-7587. How's your heart? Okay, I'm not asking because Valentine's Day is Saturday, but that's a good maybe starting point perhaps. How is your heart? How is your heart health? Do you think about it? Do you go get your cholesterol checked? I do every 6 months just for the heck of it. I have a genetic issue, plus I like lamb chops, and so I have higher cholesterol. But we're going to talk about heart health this morning. We do this periodically, and it's one of my favorite shows because I have a real interest in it. And heart disease is something that kills a lot of people. It's also something that can, if you do things right, be very preventable. So who would we talk to about heart health? I mean, there's many we could. But I think a doctor is a good starting point. Perhaps a doctor from Meharry Medical Group. Perhaps a doctor who hails most recently from Utah, but is now here in town, and we're lucky to have him. Dr. José Rodríguez. Your middle name is an E. What does the E stand for?
Ephraim.
Nice to meet you.
Pleasure is mine, sir.
Welcome. It's
Thank
good
you.
to have you here. So you've moved to the Middle Tennessee area recently.
Absolutely.
And you are what kind of heart doctor are you?
So I'm a family physician.
Okay.
I'm a primary care doctor.
But do you deal with heart health?
Every single day.
How come?
Because your heart is at the center of your body. And frankly, everything that you do is powered by your heart. Everybody thinks it's the brain, and the brain does have something to do with this, obviously.
Sure.
But your heart beats 100,000 times.
It's unbelievable.
In a minute or something like that. Not in a minute, but in a day.
Yeah.
In a day. In a year, it's in the millions.
It's just incredible.
Yeah.
And it's the size truly of an individual's fist?
A tiny bit bigger,
A
but
tiny
yes.
bit bigger than that.
Hopefully not much bigger.
We just had National Wear Red Day.
Oh, good.
And I was wearing red along with my colleagues anchoring in the morning show. And that was basically to raise awareness for heart disease, but especially in women. And there we are. Take a look, huh? Looking dapper.
Oh, very
Look,
nice.
I had my
very nice.
red sport jacket on there and my red wingtips, and everyone else looking great. Leland's got his little pocket. No, there we go. Oh, and there's the Nightside crew.
We will have to talk about those wingtips.
Okay. Well, here we go.
Because I need to get some. I just need to
got
know
a
where.
bunch of different colors. But yeah, I mean, I was curious with this. We have the National Wear Red Day for heart health, but also with a focus on women. Is there a reason there's a more of emphasis? I know for years it seemed like a lot of the focus on the research was heart health with men, and women were ignored in a way. But that's changing, I hope. And is there also a higher incidence of heart disease in women than men?
So it's not a higher incidence in women than men. The issue is that it presents differently.
Okay.
And so the thing is, we were taught as physicians that really women who are of reproductive age and before menopause, from menarche to menopause, so from the time they have their first period to the time they have their last one, really there's a lot of estrogen in the blood, and the estrogen actually protects the blood vessels. It makes it harder for the cholesterol to stick.
Okay.
But after menopause, the estrogen levels go down, and then the cholesterol sticks just as well as it does in men's hearts.
I see.
And so the idea was, oh, well, women aren't going to get heart attacks because they have estrogen in their blood, and they forgot about the fact that bodies change.
Sure.
And so what ended up happening was a lot of women would go into the emergency room, have chest pain, be about my age in their 50s, and go, they get sent home being told that it was a panic attack because women your age don't get heart attacks. And it turns out that it was a heart attack. And so that's why we need more awareness on this, because we do know that women do get heart disease at the same rates as men do, especially once they go through that change.
Okay, so there's no real difference between gender other than what you just described when it comes, it does not discriminate.
No.
Everyone. Does it discriminate among races? Is it more likely, one race from another?
So it's interesting you bring that up. Most of my research has been in health disparities and in health inequities. And one of the things that we do see is that there are certain social factors, and race is a social construct that are associated with higher incidences of heart disease. So if you look at the Black or African American population, they'll have higher incidence of heart disease than, for example, the Latino population.
Is that a genetic reason or is it a lifestyle reason?
No genetics involved in this.
None. Okay.
What the real reason is social factors.
Gotcha. Sure.
You know, there's
Diet,
stress, there's all these other things. You know, racism plays a part in this, and sexism plays a part in this. All these isms that cause other stresses for people, those cause problems for your heart. And you know, when you look at the Latino incidence is less than it is in African Americans. However, that doesn't have to do with genetics either. It has to do with the fact that the Latino population is a largely younger population that's fueled by immigration.
Okay. Now, there can be genetic components, can there not be, to heart disease? For instance, I believe I'm more prone to have high cholesterol just looking at my family history than others. That can play a role, can it not?
So yes, there is a genetic condition that's called familial hypercholesterolemia, which means that those people have higher cholesterols genetically. Like there's a gene that controls that. Okay. And those people are at higher risk because there is an association with having higher blood cholesterol levels and having higher blood cholesterol, not blood cholesterol, but blood vessel cholesterol. Yeah. So if you think about heart disease is all about cholesterol getting deposited in the wall of your heart vessels. Yes. Particularly your arteries. So when we think about heart disease, we should really be talking about atherosclerotic cardiovascular disease. Okay. Which means hardening of the arteries? Hardening of the arteries, cholesterol deposits in your arteries, not just in your heart. All over your body, they can get cholesterol deposits. If you get cholesterol deposits in your brain, those arteries get smaller and smaller, and the smaller your arteries get, the more likely they are to clot. And when a hardened vessel clots, that's a heart attack.
Or is a stroke?
Yeah, if it's in your heart, it's a heart attack. Okay. If it clots in your brain, it's a stroke. So it's the same pathology. And so there is an association with having more cholesterol in your blood, because if you have more cholesterol in your blood, your body tries to figure out what to do with it, and so it starts to put it into your arteries. But that's a small piece of it. Okay. Almost all the rest of heart disease has to do with how we are raised and what we eat and what we do. In fact, what we do is probably the most important piece.
Do you know where I was 2 weeks ago?
Running a marathon. No.
It was a location. I was in a blue zone, one of 5 in the world. It was in Costa Rica. And there's a blue zone.
Oh, interesting.
A blue zone is an area, there's 5 of them, as far as I know, maybe they've added, where the population has got a higher percentage of those that live to be 100 years old than any place else in the world. And I was there for surfing, but it's like, it turns out it was in the middle of a blue zone, and it was very interesting to observe and see the diet and what we ate and what we did and what contributes to it. And it's exactly, I just brought that up because what your last statement was. How you live can really dictate, you know, whether or not you get the heart disease. And it's just interesting to see these people in these areas. And these are, in the area I was at, it was not a rich area or something like that, socioeconomic or whatever. It was nice, it was comfortable or whatever, but the foods they eat and the lifestyle they led play an amazing role. And it just seemed more laid back, easier. They're very health conscious, they're very environmental conscious. They eat very healthy. What it is they'll eat meat, but not a ton of saturated fat, but they don't eat almost anything processed.
Well, and that's a big deal, right? Processed foods do have a lot of things that make them readily available. And one of the things that makes them readily available is the things they use to preserve. And some of the things, we're not going to talk about artificial preservatives, that's a whole nother discussion. But let's just talk about salt. Yeah. Okay. Right? Salt is one of the, I mean, it's a very, very old preservative. I
guess, but it's a natural preservative. It's not something made in a lab, right? I mean, salt, I love salt. Salt is, my friend, fat and salt. Yeah. What do they represent? flavor.
It's
you take
delicious.
fat and
It's
salt
delicious.
out of your food, and the odds are it's going to be tasteless. Now, there's other ways you can arrange your food to add taste with herbs and spices, but salt and fat are flavor. You take salt and fat out of our diet, and your plate doesn't taste good. I'm sorry.
That's true.
Okay, but so it's moderation. But I'm sorry, I interrupted
It is
you about
absolutely
salt
moderation.
as a preservative, right?
But the issue about salt is that salt intake is also associated with hypertension. And we've got to talk about high blood pressure if we're talking about the heart and if we're talking about blood vessels getting hardened, because it turns out that if you have high blood pressure, your heart is working harder. It is also associated with your arteries getting harder as well. So we need to, and this is why Family Doc is so important for heart disease, because we're the ones who take care of people who have high blood pressure.
Yeah.
They come into our office, we're the ones who find out, because they start seeing us when they're kids, and then as they get older, they start to change. We start to change with them, and we're able to know them as they go through the lifespan. And that makes a huge difference.
Yeah. I'll tell you, you're right. And you come in, that's one of the first things you do during your physical exam.
Every time.
Is have your blood pressure checked. And then depending on, I do a blood scan. Would you say that's important? To have your blood drawn just to check HDL, LDL, triglycerides?
I think getting your cholesterol checked is a good idea, for sure. Especially if you haven't had it done for a while. Really, you know, there's no such thing as routine labs. So when somebody comes in to see me, it's not like I have to get the same thing for everybody. But if you're coming in to see me and it's time for your physical exam, I'm definitely going to check your cholesterol.
Sure.
I'm going to check your blood pressure, and I'm going to talk to you about the things that you and I need to be doing to preserve our health. One of the things is, you know, what we do with our diet. What's the foods that we're eating? The easy way is, if it's green, it's good, and if it's not as good.
Do you eat much that's white?
So that's another thing.
Now,
White is bad.
Yeah, except cauliflower.
That's
my go-to when it comes to white. Cauliflower is very good for you.
It is very good for you.
But you're right, I brought that up because that's about the only white thing that's good for you. White sugar, white, not good.
Even potatoes. I mean, everybody thinks potatoes is, when you ask kids what is a vegetable, they'll tell you potatoes are vegetables. But potatoes aren't vegetables. Potatoes are carbs. And
well, but isn't not categorized as a vegetable?
It
though?
grows in the ground.
Yeah, it's a root vegetable.
It's a root vegetable. But the thing is, what do we eat in potatoes?
The inside of it.
That's all we eat is the inside. And where's the fiber and the stuff that's good
in the skin?
Fruits?
So you scrub it and you want to eat all of that. That's a great point. Yeah, potatoes, and especially, you know, sweet potatoes?
Sweet potatoes are better because there's more fiber on the inside.
But wash the skin really good,
Eat
okay?
the skin.
And scrub it a bit, and then maybe rub it a little olive oil, and then bake the whole thing, and eat the whole potato plus the skin.
Absolutely.
And do not put a bunch of bacon bits and sour cream on it.
Well, you could put some, but don't put a lot. You're absolutely right.
Put a lot.
We have a saying in Spanish that I like to say, and that's una vez al año no hace daño, which means if you eat it once a year, it's not going to hurt. Which is true.
Once a year.
Things you do once a year, not a problem. But una vez al mes es al revés, which is if it's once a month, then it becomes a problem.
But once a month, having a loaded baked potato once a month is not going to kill you?
A potato once a month is one thing. It's alcohol, it's other things that we do that hurts our body.
All right, a lot to touch on. We're going to take some phone calls. If you have a question about your meds or anything, well,
ask.
We can talk about statins and that, but heart health. Look, if you're sitting at home watching, I don't care who you are. You got an issue with your heart to talk about. Maybe you're doing well now, but let's keep it that way. Feel free to join in the conversation. We'll take some calls and continue our conversation with Dr. Rodríguez right after this. Stay with us.
A guy on a cell phone was trying to squeeze between us and an 18-wheeler.
We flipped over 3 times and landed upside down.
I broke my neck in the accident, and they didn't know if I would be able to walk again.
We tried to handle it on our own, but the bills started piling up.
I wanted the best attorney I could find, someone who really cared about their clients. If it wasn't for Ponce Law, I may not have recovered.
If you've been involved in a serious accident, call Ponce Law today, 615-244-4321.
This is a Talk of the Town Extra.
Well, do you suffer from pain or numbness in your spine or your legs? You may be suffering from a painful condition called spinal stenosis. To tell us more, we have Dr. Kevin Mitchell here and Dr. Ashley with the Wellness Institute of Nashville. Thank you both for being here.
Thank you.
All right, tell us first what spinal stenosis is and what are some of the symptoms?
Spinal stenosis is a choking of the hole where the nerve comes out at the spinal level. And when that hole collapses on that nerve, it's like driving a car through that tunnel, it collapses, it pinches the nerve, and then you have all these tingling and numbness in your arms or legs or weakness.
Well, Dr. Ashley, what are some of the treatments you offer?
Well, what we do for spinal stenosis is we offer non-surgical spinal decompression, where it gently elongates the spine, allowing for that disc to go back in, takes pressure off the nerves, and takes all the symptoms away as well.
Well, a lot of your patients that you see have gotten relief through this treatment. Let's hear from one of them now.
So I've had back problems for about 20 years. I played collegiate and professional football. I called the Wellness Institute after I was having second thoughts about a scheduled surgery. The treatments here at the Wellness Institute have been excellent. Both doctors, Dr. Mitchell and Ashley, his daughter, are very caring, and they take care of their patients. I am 100% better over these several weeks that I've been coming.
Well, what special offer do you have for us today?
Oh yes, for the first 40 callers, they can have an exam consultation for only $29.
All right, guys, thank you both so much for being here. For more information, you can visit the Wellness Institute of Nashville with what you see on your screen. Again, for that special offer for the first 40 callers.
You've worked hard your whole life. Now it's time to make your retirement dreams a reality.
Welcome to the Retirement Report. I'm Hank Parrott. A great opportunity, and that's going to factor into your overall planning. Hi, I'm Hank Parrott. On the Retirement Report, we give you the tools you need to secure your financial future and live the retirement you've always imagined.
Tune in each week on Newschannel5 Plus and start planning your best retirement today.
We are back on Morning Line. Thanks for joining us. Talking heart health with Dr. José Rodríguez. He is a general practice physician.
Family physician, yep.
Family physician at Meharry Medical Group. But certainly much of what you deal with is with hearts and taking care of yourself. And that's where you start. He says your brain, your heart. And that's really the two places you really want to focus on. We got a caller waited through the break. We'll take it. Smith, good morning. Hi, Smith.
Yes.
What's on your mind?
How y'all doing?
Good. How are you doing?
Fine. I got 3 short questions.
Okay.
My friend in Kentucky, she goes to a doctor, and she got a lot of problems, and the doctor's telling her to eat lots and lots of salt. And I tell her not to do that.
What? Yeah, that's crazy. Okay.
And my next question, potatoes are good to a point, but sweet potatoes, you can cut them up like French fries and deep fry them, and they're the same thing.
Okay. Well, no, look, come on, man. You know better than that. Deep frying anything is adding fat to it, okay? Period. Don't tell me it's the same thing. If you fry something, it's not as healthy if you bake it. End of story, period, right. No debate. You understand that, right?
Yeah.
Okay, go on. What's your third thing?
Okay, doctors need to treat people better. They tell her all the time, lose a lot of weight, and she done lost 30 pounds.
Yeah. And so she needs to lose more?
Well, she only weighs about 200-something pounds, and they keep saying she's obese.
Okay. How tall is she?
Yeah.
How tall is she?
About 5'6", I think.
Okay. All right, well, yeah, okay, first of all, is there any condition where you would tell someone to eat a lot of salt?
I can't think of one right now, but I can think of people who have salt wasting diseases.
Okay.
And if they have a salt wasting disease, then that's something we should think about. But those are very rare.
Other than that, salt in general, more moderate. You wouldn't want to be eating a lot of salt.
No, it's because of the association with blood pressure.
Yeah.
Blood pressure is bad for your heart, bad for your arteries. And so salt needs to be moderated.
Okay, and was I wrong about deep frying anything?
No, you're not wrong, especially what you use to deep fry, because some people will take and make bacon and then use the fat to fry the fries.
Yep.
Which is different than using vegetable oil.
Hey, we're here in the South, and there are people, and it can be delicious, all right? But lard or animal fat and frying, you're asking for trouble if it's a regular thing. Now, you know, a biscuit made with lard is absolutely delicious. Okay,
There's
it just is. But lard is animal fat. Now, we have a director of health and human services now who is a little bit controversial at times with some of the things. He's reassessed our food pyramid and all of that. Some of what he says in terms of cutting out processed foods makes perfect sense. In my opinion, some of what he says is pure idiocy. Okay, how do you tell people to, and I don't want to get political here, okay, but how do you tell people to gauge what we're seeing in this new food pyramid?
So this is interesting. The food pyramid has been around for a long time, and they've changed it many, many times.
Okay.
And so there was a time that the food pyramid had layers like this, and then there was a time that the food pyramid had layers like this. The food pyramid, I find, is a tool that people should use with other tools. And so I agree that there's a certain amount of stuff that we need to change in our diets. I think the consumption of highly processed foods, the consumption of a lot of carbohydrates, compared to protein, I think that needs to change, right? And I think there's some good things that they're doing. One of the things, reevaluating what we put into food is a good idea.
Right. They just banned, I think, one of the preservatives, or red food coloring or something like that, just recently.
So red food coloring, some of it comes from insects. I'm not fond of eating bugs, but I think if it's coming from insects, it's probably better for you than if it's coming from petroleum or oil. And so I think reevaluating this stuff is a good idea. However, going back on this, food pyramid is part of the equation. Remember, green is good, white, except for cauliflower, not so much. But there are things that, white bread, not as good as whole wheat bread, right? White rice, not as good as brown rice. White potato, not as good as sweet potato. And so you could think about those things simply, but really think about what you put in, and it fresh and green is better. And I think most people like fresh fruits. But the thing is, we do things to our fruits that we probably shouldn't. Think about a kiwi. And kiwis are delicious. But the real good stuff in the kiwi is actually in the peel. The first thing we peel off.
You eat the fuzzy peel?
I eat the fuzzy peel.
I never thought of that. So
I know people who eat mango peels.
Oh, yeah. Okay, do you eat banana peels?
I don't eat banana peels. But again, the good stuff, unfortunately, is in the peel. The banana is delicious. So think about the things where you can eat the outside. So you can't really eat the outside of the orange. But there are cultures who do this. So think about, when you went to Costa Rica recently, and in Costa Rica, when they're serving the orange, they'll cut a portion of the peel off, and then you'll have an orange that is covered in the white stuff. And then they'll squeeze the juice out of it. But I would say also eat the white stuff, because even that part of the peel is better for you than some of the stuff that's inside.
Is that nutritional or is it more fiber?
It's almost exclusively fiber.
And we need fiber because fiber helps carry the fats out of your system?
Fiber helps carry a lot of stuff out of your system, because what it does is you have fiber in your gut, it brings water into your gut, and then it makes it so the things that are in your blood can come out with that water and go out into your toilet.
Okay. Green, okay, all these things. When people get their blood tested, and what is your take if you have higher cholesterol? And again, there's HDL and LDL ratios.
Correct.
A very high HDL and a moderately high LDL. They can balance each other a bit, right? The ratio is, do you look more at total cholesterol, or do you try to pay attention to the ratio as well?
So the ratio is important, total cholesterol is important. There's also a formula that we use that actually puts the total cholesterol in it, your HDL, your LDL, and also some lifestyle factors. Do you have diabetes or hypertension? And you put all that information in, and then it'll give you a percentage risk factor. And then that helps us to determine exactly when we should start using blood cholesterol lowering medications.
Okay.
I'll be honest with you, I look at HDLs all the time, and I look at LDLs all the time, but when I see a high HDL, I get suspicious.
Why is that?
Because there is one substance that makes your HDL go up pretty quickly, and that's alcohol. And unfortunately, I've been able to see people who are consuming too much alcohol from their HDL levels.
And high HDL, now HDL by definition though,
it's heart protective.
It's heart protective. So is it, if it's happening because of alcohol, and then we know alcohol does other bad things, is that HDL still helpful?
I mean, I think the HDL is helpful, but the alcohol is not helpful. And I think if the alcohol is making your HDL go up, then they're canceling each other out, and you're probably worse off.
Okay.
Because one of the things that we don't talk about is alcohol raises blood pressure in everyone who takes it.
Yeah.
And so when you think about it that way, you're like, oh, wait a second. If alcohol is going to raise my blood pressure and blood pressure is going to hurt my heart, then that's another thing that's a once a year kind of thing, not a once a day kind of thing.
Yeah, well, and I used to be a recreational drinker for a year, but I mean, in the last 3 years, I've just quit drinking.
Yeah.
And my HDL is really good, and and my doctor says I have some of the lowest triglycerides he's ever seen.
Fantastic.
Now my LDL gets up there a ways, but I mean, my HDL then, he says that it's in large measure, diet of course, but he goes, the exercise.
That's 100%
is what
correct.
really pushes, and I try to stay super active. And so that, my diet's not the greatest in the world, I'll just say that. But the HDL goes up because of exercise?
Correct.
All right, not alcohol, because I'm not drinking no more.
Yeah.
And so that's a good thing. So what about statins when you go on that? I've been on them and off them. I don't want to be on any pill the rest of my life. I may someday have to. But I just came off a regimen of some statins because my cholesterol had gotten up higher. It was because of some things in my lifestyle that had changed that I wasn't doing as well on. And so I knew I'd slipped. And my doctor said, oh, wow. And he put me on 2, and my cholesterol just dropped. I went like from 400 something, which was rare, to like 125 in like a month or 2. It's like, holy
It's really
cow.
fantastic.
I don't know what the hell he put me on, but it was potent. And I didn't have side effects from it, but I've weaned myself off those statins now, trying to dictate it with diet and exercise, and I will go back in soon and have another blood scan, see how I'm doing. So what's your thought on statins?
So
some people say, take them always. They're going to be great. Even if you don't have high cholesterol, take them.
Well, I'm not in that camp. But I do think that they're a potent tool to use, and people who can control their cholesterol with diet, I would love for them to just use their diet to control it.
That's what I want to do, yeah.
And it's hard to do.
Yeah.
And really that has to do with consumption of animal products, and that's really hard to take out of your life. Now, people do it. I have a son who's vegan.
Sure.
Doesn't eat anything animal products.
Good for him, good for him.
It's impossible to go out to eat with him, but he's done it, and I'm not going to ever worry about his heart. Sometimes I'll worry about the fact if he's getting enough calories, but that's a different issue.
Enough protein, or you can get protein from beans and everything. Yeah.
That's actually the best source of protein. Also the best source of iron.
Which is what they eat a ton of in Costa Rica.
That's exactly right.
We'll take a break. That's one reason that area is a blue zone. More of a conversation. We're going to take a quick break right after this.
This is a Storm 5 weather update.
Good morning. We're waking up on the chilly side, but you know what? It's seasonal. This afternoon, seasonal conditions continue as highs will be into the low to mid 50s. Rain chances do work their way in Saturday and parts of Sunday. It's not a complete washout, though. Here's a live look at the current temperatures across Middle Tennessee as well as Southern Kentucky. You'll notice when we take a step out, we all are dealing with some pretty decent conditions. So in case you needed to travel to the Tri-Cities, Paducah, things are right on track thanks to high pressure that continues to be with us. And we're going to continue to have clear skies as we go throughout the day. Just a few passing clouds with a lot of dry conditions, not only today, but also as we make our way overnight tonight and into tomorrow. Tomorrow, another seasonal day. The difference, temperatures a little bit warmer and clearer conditions for you. Your 7-day forecast, highs today will top out into the low to mid 50s. Tomorrow, right around freezing. By the afternoon, 60 degrees.
Store-wide savings at Wilson County Chevrolet Buick GMC. We've dropped prices on every single vehicle on our lot. Save $12,000 off Silverados or $10,000 off Sierras. 20 minutes east of B&A. WilsonCountyMotors.com.
After an accident, the truth matters, but sometimes proving what really happened isn't easy. Insurance companies may deny liability, drivers may dispute fault, and if there's no witnesses, it's your word against theirs. We have the Ponce Crash Cam Network, giving us exclusive access to recorded accident footage from a network of 208 cameras across Middle Tennessee. The evidence doesn't last forever. The footage is only stored for a limited time, so if you've been injured in an accident, you need to act fast. Call Ponce Law. Justice for all.
Store-wide savings at Wilson County Chevrolet Buick GMC. We've dropped prices on every single vehicle on our lot. Save $7,000 off Enclave. Buy the Traverse for $39,120. 20 minutes east of B&A. WilsonCountyMotors.com.
We are back on Morning Line. Thanks for joining us. José Rodríguez is with us. He's a doctor at Meharry. And we're talking heart health this morning. We were just touching on statins. A lot of people watching, I bet maybe you're on Lipitor, or Zocor, Crestor, or one of those. And there's some that say, oh, I don't want to be on these pills or the side effects, or well, my brain needs that cholesterol. I don't want to cut out all the cholesterol. And like I said, there's plenty of naysayers, as there are with all kinds of medicines these days, unfortunately. But I find that they work. I just don't want to be on the pill forever if I can control it otherwise.
And I agree. When it comes right down to it, statins do feel like a forever drug. But, you know, it's not forever, because there comes a point in your life that statins don't increase your life expectancy. And at that time, maybe you don't need to have them. And I do feel that they're a potent tool in our war against heart disease. And I think that people who are prescribed them need to take them. But I know that some people don't get great side effects, and when they have the side effects that are annoying to them, whether it's muscle cramps or memory problems or whatever it is, they'll stop. And so we have to make sure that there's other alternatives.
There's a bunch of different alternatives. Knock on wood, I don't think I've ever had really noticeable side effects, maybe mildly, and they're nothing permanent. You come off it and you're feeling better, but there are alternatives. If this statin doesn't work, there may be something else,
Absolutely.
Right? So you can explore it, and the hazards of having high cholesterol
are much greater than the hazards of taking the pill.
Right.
And so you want to take, if you get it prescribed, you have a good relationship with your doctor, and she says, you know, you need to take this for this, and this reason, I think you do what your doctor says.
Yeah.
And then you do shared decision making. If there comes a time where you feel like you can't take the medicine for whatever reason, you talk to her and say, what do I got to do? What can I do with this? And maybe you change meds, maybe you change lifestyle, maybe you change diet, maybe you do all three.
Yeah. Okay. You and I both have CPAP machines.
Absolutely.
Does that have anything to do with heart health?
Oh my goodness, of course.
Okay. CPAP, I forget what that stands for.
Continuous positive airway pressure.
That makes sense. And these machines, you've seen the commercials and all this, and I have one that's just a headgear that goes around. And there's all kinds. There's people with full masks or whatever. I just have two little pillows that just touch on my nose here. And you still have to get used to the cord, and it takes some getting used to.
It does.
But it changed my life in a large measure. You had to do a sleep study? Did you do
I
one?
did a sleep study.
And you were waking up every few minutes because of blockages. Your throat relaxes, and you basically start suffocating. Your body wakes you up, so you breathe again, and then your sleep sucks.
That's exactly right. I had no idea. I found out about this because I had a friend in medical school. We saw him for my 25th reunion after graduating from medical school. And he's like, you know, Jose, you probably had CPAP your whole life. I go, what are you talking about? He goes, we were roommates in medical school. He says, I remember how you were when you would sleep.
You would snore?
Yeah. Apparently I did the whole the whole thing.
Meaning that you actually stop breathing. So by the way, there can be a difference. I mean, having a serious sleep apnea is when you stop breathing and your body kicks in, and we all know what happened to the great Reggie White, football player, who CPAP killed him. He stopped breathing and he didn't wake back up, and it puts strain on your heart.
Sleep apnea killed him.
Sleep apnea. I'm sorry, not CPAP. He didn't have a CPAP, I don't think.
Yeah.
But when you have snoring, does that necessarily mean you have sleep apnea for sure? No. There can be other things you can take to treat that, like mouthpieces to adjust your jaw. But sleep apnea is when you literally stop breathing.
That's correct.
And that's dangerous.
It is. It is. And the reason it's dangerous is because it affects how you rest. And I didn't know this. Before I got my machine, I'd work, and I'd get home on Friday night, and I would fall asleep in my car, in my garage, out of gas. And then, after I talked to my friend, I said I had no idea this could be possible. I went, got the CPAP machine, and total life changer.
I know.
I was like, energy, and it changed all sorts of other things. Requirements for other medications that I was taking went way down. It was magnificent.
I try to tell my friends this. I said, listen, and I've had a few that have listened, and others that just, oh, no. And I'm like, trust me, it will change your life, and it may save your life too. And I guess everyone, you know, some people, they have to come around, I have to go to the doctor, I have to do this sleep study where you wear something and they measure your breathing one night overnight, and that's fine.
Actually, there's a sleep study now where you can do it at your own house.
Oh no, I have. Now the one at home, the one when I went in and had to stay, I don't know if they do that much anymore because of cost or whatever, but that one was very efficient and very well done. When I did it myself at home, it didn't come back with me being as serious with sleep apnea. Maybe my breathing had improved. Maybe I just screwed up the test and didn't do it right.
There is that possibility. And so if you need to be tested again after doing a home test, I think you go and tell your doctor, listen, I don't think this is real. Can you get me another test? And you work with her, figure it out.
But boy, it really does. Now, what is the strain it puts on your heart?
Well, the strain it puts on your heart is the fact that you're not getting enough rest. So think about what your heart does when you rest. One of the things that happens when you sleep is your blood pressure goes down, your heart rate goes down. And so that, you know, for a machine that's working all the time, it's very important to get less work during that sleep time. And so if you have sleep apnea and it's not treated, your blood pressure is going to be going up. Your heart rate is also going to be higher because you're not sleeping as much. And so think about it, even if it's just 10 beats a minute, 10 beats a minute, how many minutes are there in an hour? Right, that's already 600 beats.
That's a lot of beats that you're saving your heart stress.
This is the thing. When you save your heart beats, it makes it so that machine can last longer. My grandmother died in 2022. She was 106 years old.
Wow.
Yeah.
Wow.
So I asked her, how is it that you got to 100 years old when she turned 100? And she told me some stuff. You know, she graduated from high school, but that's as far as she got. And she told me some stuff that really, really makes a difference for people. She said, you know, make sure that you eat a lot of green stuff. Avoid, this is the thing. She said, avoid come y vetes, which is the things where you go in, where what it means is fast food. Avoid fast food.
Yeah, but didn't she love a good churro?
I mean, no, she didn't.
She wouldn't eat a churro.
My grandmother's Puerto Rican. My grandmother, if she had churros, they'd have to bring them to her because I don't think she'd go out and buy them.
Okay.
And my grandmother was all about, you know, they were farmers, and they were all about eating stuff from the farm. And so it was very different. And she would also say to me things like, eat things that are made close. And I was like, wow, that's fascinating. The whole farm to food, farm to table movement, that's about, you know, how they don't have to transport things. But, you know, she was onto that before we knew that sometimes apples are traveling for 9 months and things have to be preserved to get to us.
Right.
And she knew all that long before I knew the science that backed it up. And so she didn't live in a blue zone. But
no, she lived like that. It wasn't blue. She made her own blue zone in her own bubble. And I'm guessing she didn't drink, and she never smoked. And she got, I bet, good sleep.
She did get good sleep. My grandmother used to say that her alarm clock was San Judas Tadeo, which is St. Judas Thaddeus. And I'm like, really? She said the saint would wake her up every morning at 5:15. And that's the other thing she said. You wake up at she wake up at 6 o'clock if you have to wash. No, it was at 5:45 if you have to wash, but it's at 6 o'clock if you don't have to do the wash.
If you don't have to wash, if you don't. But she would wake up automatically without an alarm clock.
That's exactly right.
And she went to bed when she felt like it or whatever along those lines. to live to be 106. I mean,
106. And a brain good until the last day. Unbelievable.
All those things combined. Now, there's maybe a genetic component as well.
I hope so. She's my grandma.
She's your grandma, so that could come into play as well. But yeah, just these things. People are, listening to this and they realize, is it too late to make a change?
The answer to that is always no.
Always no. It's funny. I don't have it off the top of my head, but recently my colleague Jennifer Krause gave me this new app that I use, and I go now and I shop, and you scan the barcode, and it tells you. Basically, it will give you a rating and say either, poor, okay, good, great, excellent, whatever. Like oatmeal up here, excellent. It's 100 out of 100. The artificial bacon bits that I love.
Yeah, not 100 out of 100.
Artificial bacon bits was 0, and that's the very lowest you could get. Poor. I mean, it's gonna not good for you. But I mean, I've started scanning stuff when I can at the store, and it's amazing the types of things that I thought. Maybe because of the way they were packaged, and I thought they were better for me than they were. And the neat thing about this app is it says you don't want to eat this, but then it gives you alternatives that are good if you can find them. But that's the change that I've made, where I've started. I was thinking I was eating these power bars that were good for me or whatever. I stand on my own. No, and most of the time it's not. Yeah, they had high protein like what you're looking for in Power Bar, but they were high in additives.
Of course.
And some additives and processing that's just not good for you. And go to the grocery store and try to find stuff, aside from the vegetables and fruits, that is not processed. It's hard, man. Find something with only a few ingredients on the label. Man, good luck with that.
Well, process increases shelf life, and shelf life increases profits.
Right.
And so what we have to start looking at when we're talking about things that need to change, we have to start incentivizing good behavior. I hate to put that qualifier on it. Healthy behavior is really what I said. Incentivizing healthy behavior. Like, so what makes it, what's healthy? Walking is healthier than riding. So how do you make a healthy community? You make your streets safe, you make sidewalks, you make bike lanes, you do that kind of stuff. How do you help people make decisions when they're shopping? Some people have the app, great, God bless them, right? But a lot of people aren't going to have that, and they need something quick. And if you're looking at these things, and at my age, you got to go like this to try and see them. Those little nutrition facts don't really, they're hard to read. In Ecuador, they have a red light, yellow light, green light system. Yeah. And if something is high in fat and sugar, they just put the red light on it.
Yeah, okay.
And if it's medium range for fat and sugar and salt, they'll put the yellow light. And if it's green, it means it has low fat and low sugar. So they can just look at it quickly and say, oh, this is a green product and this is a red product. Maybe I shouldn't buy as many red products as green products.
You might want to still buy 1 or 2 of those for, whatever. You don't have to cut it all out.
Your special occasions.
Yeah, but I love that idea. Something like that would make it easier for folks. Sometimes the stuff that's green is more expensive too. We'll take a break and talk about that, just how you can eat healthy and affordably as well for your heart and health in general. We'll be right back after this.
Injured and unsure of what to do next? I'm Allie Toll, and I'm here to help. After a serious accident, life can spiral fast. That's where the Toll Firm steps in. We're here to stand beside you every step of the way.
The Toll Firm, a trusted expert on 5.
You've worked hard your whole life. Now it's time to make your retirement dreams a reality.
Welcome to the Retirement Report. I'm Hank Parrott. A great opportunity, and that's going to factor into your overall planning. Hi, I'm Hank Parrott. On the Retirement Report, we give you the tools you need to secure your financial future and live the retirement you've always imagined.
Tune in each week on Newschannel5 Plus and start planning your best retirement today.
Hi. I'm Dr. Matthew Bruin, CEO of Apex Recovery. Right here in Tennessee, too many families are struggling. In the last 2 years, over 6,000 have lost their lives to overdoses, and nearly 1 million adults face mental health challenges, most without the care they deserve. We are here to help. At Apex Recovery, we treat both addiction and mental health. Don't face this alone. Visit us online or give us a call. My team and I are here to support you and your family.
If debt has become a part of your story, maybe it's time for a new chapter. Connect with NFCC. We match you with trusted nonprofit credit counseling services to provide you a path to financial freedom. We're your sidekick that can make you feel like the main character in your story again. No judgment, no pressure. just the advice you need on your terms. Visit nfcc.org/yourside or call 833-837-7698 to get started. NFCC, on your side, by your side.
Me and my son were driving down the highway and we were rear-ended by a drunk driver. It was an extremely traumatic and life-changing event for us. The toll firm has been really great, helped me get a settlement quickly.
The Toll Firm, where justice finds its voice.
We are back on Morning Line. Thanks for joining us. We are talking heart health this morning, general health as well, but it is all combined in one under the umbrella. José Rodríguez is the doctor with us this morning. He's with the Meharry Medical Group. It's good to have him on. And yeah, I guess, you know, there's an importance to go and seeing a family physician like yourself on a regular basis. I have more friends, predominantly male friends, who have not seen a doctor in years, and that baffles me, and part of it is how you're brought up, I imagine. My parents always took me to the doctor every year, at least once or twice a year, and vice versa for checkups. Seriously, there are a lot, especially of adult males out there that haven't seen a doctor in years.
Of course.
And I'm like, dude, you heard the silent killer? You know what that means? You don't know what's happening. You need to go check high blood pressure, heart disease, other stuff. They only go when they're sick.
Mm-hmm.
And so how important is it to just go, I'll let you say it because I can, to see a regular checkup at least once a year?
Yeah. So in the regular checkups, we do screening specifically for heart disease. The most common screening for heart disease is actually your blood pressure check.
Okay.
And getting your blood pressure checked is so important because blood pressure, high blood pressure, is super prevalent. It is everywhere. I don't think there's anybody who doesn't know someone who has high blood pressure. And the thing is, it's so treatable. You could get a pill and it'll lower your blood pressure. If you could get on a treadmill 3-4 times a week, that's even better.
Yeah.
You know, I always used to think, you know, exercise is such a pain, and how can it help your heart? Because if you're doing exercise, I mean, I go there, I grab onto the thing, and my heart rate goes up to 180. And I'm like, wait a second, that's got to be bad. My heart is beating more. But it turns out that when you're doing exercise, your heart is beating more during that. And then the other 23.5 hours of the day, your heart will actually beat so much less frequently that it more than makes up for the time that you push your heart during that time.
Right.
And so you can lower your heart rate, and exercise is like the opposite of alcohol. Exercise lowers everybody's blood pressure.
But how about having a beer before you go for a run?
So that's probably not a good idea. I've run 10 marathons, and I got to tell you.
Have you really? Wow,
lots of people do beer after the marathon.
Yeah, or the carb loading the night before, whatever, if that works. All right, so warning signs. Just for someone maybe sitting there, and you know, some you may know of, some maybe you're not as aware of. What can be an indicator you might be, if you're someone who hasn't been to a doctor in a while, dealing with some cardiac issues?
So shortness of breath is a huge one. So if you're
climbing up some stairs and getting shortness of breath.
Climbing up your stairs, or some people will get it not doing anything.
All of a sudden shortness.
And that is actually more dangerous. When you have climbing up the stairs, we call it dyspnea on exertion, right? You have it on exertion, it is something that tells you that it's only when your heart is strained. But when you're having it at rest, that is an immediate thing. That means that a heart attack is imminent.
Okay.
So you gotta get
And when
seen.
you say shortness, meaning you're having trouble breathing a bit, breathing in, or whatever, it's tightness in your chest maybe? Or
yeah, well, think about how you feel after you run to catch the bus.
Yeah.
That kind of...
If you're feeling like that and you haven't done anything, you got a problem,
That's
dude.
exactly right.
Okay, what about pains? I mean, and sometimes, can you tell the difference between heartburn and an actual beginning or warning sign of a heart attack?
So this is a very important one, because we as Americans don't eat well. And so there's a large portion of the population that has heartburn that is not cardiac related. And patients confuse them all the time.
They do.
And what I would say is we have great treatments for heartburn. Come and see us, because the problem is there is very difficult for the patient to tell the difference between heartburn and a heart attack.
So you go in and hopefully you get good news and it was just heartburn.
That's exactly right.
But
and the other thing that I'll say about that is that, you know, everybody thinks about chest pain as the sign for a heart attack. They go like this, I'm having a heart attack. But the truth is that sometimes heart attacks don't have any chest pain. Sometimes people who have diabetes can have a heart attack without having chest pain. They don't even feel it. Sometimes women who are having heart attacks, it presents differently. They might have pain. Sometimes they'll have pain in their chest. Sometimes they might have a pain in their back or in their side. Sometimes it'll show up as something that looks and feels like anxiety, but it's actually a heart attack.
And so that's why you go for your regular checkups to find these warning signs, because you may ignore something that is very serious, thinking it's a muscle pull or anxiety. Okay, why did you want to go and be a doctor anyway? What led you to become a physician?
You know, I asked myself that many, many times. My mother and my father both were the first college graduates in their families.
Oh, really?
And they both went to the University of Puerto Rico, and both of them studied science. My father studied chemistry, and my mother studied nutrition, and they both wanted to be physicians. They never told me that until after I started medical school.
So you just naturally went that way. Of course, your parents were in that realm.
I am extraordinarily blessed and fortunate. I will tell you one thing that did change my life, and that is I was serving as a missionary in Paraguay, and I had a missionary companion who got really, really sick. And he went to the doctor's office, and turns out he had appendicitis. So they took out his appendix, and you know, our parents were here in the United States. And so I was the next of kin. So the doctor came out to me and said, listen, the appendix operation was great, it went well. And I said, can I see the appendix? And the guy brought it to me. And I was like, this is cool. I think I could do this. And from that time on, I thought I could be a doctor.
You saw that, meaning you didn't get queasy, blood doesn't bother you?
Yes.
But now, doing that, and you saw that you can be a doctor, but did you think about becoming a surgeon?
I did think about becoming a surgeon, and because surgeons, you know, the language of surgery is cure. I can cure appendicitis by taking out the appendix. I can cure, you know, gallbladder colic by taking out the... Right? And the language of family medicine and of a lot of other medicine is control. And so...
Well, you diagnose too, right? Yeah.
But really, we diagnose and we help people control their conditions, right? And that's a little bit different. What turned me off to surgery was really had to do with the fact that I don't really like blood that much. So,
it's not for everyone.
So it wasn't for me. And but I love working with surgeons. I have some fabulous surgeons that I work with at Meharry and in other institutions that are just wonderful people.
Okay. Like I said, you were in Utah before this at university there?
University of Utah.
And then, but just then, you've been in Paraguay, you've moved around, you've seen a lot of different types of patients. But here, you just wanted to move to Music City because it's a cool place.
I wanted to move to Music City, but I was attracted to the mission of Meharry. So my other job at Meharry is that I'm chair of the Department of Family Medicine.
Okay.
And I have this beautiful opportunity to build up a department that does great work with patients that have been traditionally neglected by society, and that to me is beautiful work. So we have a few clinics that we run. One of them is a clinic that actually treats people who are struggling with addiction. Another one is a family medicine clinic, and we have people who are working in sports medicine as well in our department. And all of those things together are done with the focus on getting our skills and services to the people who need us the most.
I know, and that's wonderful. And that's a wonderful thing about Meharry and General Hospital, the food pantry that's there, and everything else. My good friend Reverend Fuzz got that all going, and thank goodness for that.
It's a great thing.
It is. I'll tell you what, it is a pleasure. One of these days.
So nice to meet you.
I may have to come, and you know, who knows, when my doctor retires.
That'd be good. I'd love to have you.
Are you sure? Because I talk a lot. I ask a lot of questions, you know.
Those are the best patients.
And maybe at some point, your wife would make me tacos.
What you have to have from her.
Because that's what you had for dinner last night.
That's right.
And
her best meal is tortilla de papa. You'll love it.
I'm going to hold you to it.
That'd be great.
Very nice meeting you. Thank you for coming on. It was a great conversation. Really do appreciate it. We'll talk again, all right?
I hope so.
Take a break. I'll be back to wrap things up right after this. Stay with me.
I'm attorney Blair Durham. A crash doesn't end at the wreck.